Hello, and welcome to Mulready Minute Podcast with host Oklahoma Insurance Commissioner Glenn Mulready. This is a podcast about insurance for insurance folks, risk managers, and business leaders. We'll dive deep and look at what is and isn't working, talk to leaders in the industry, and keep you informed on what's happening in Oklahoma and around the country.
Okay, please keep enjoying your meal, but we are going to get started on our next segment. I personally am pretty excited about this next segment, but it is to be had while you're enjoying your lunch. I won't make any comment about that we have a nutrition expert here with us, and we're not going to be examining or commenting on your plate, but excited to have here with us today Lance Walker. I met Lance a few months ago and just engaged in some conversation and what brought him to Oklahoma and what he was doing. And I mentioned, hey, we need to have you on our podcast. And then this came about, thought, let's do a podcast live at our big meeting where we have thousands of people gathered for lunch. They don't know that on the audio recording. But I'm excited that he's come down from Stillwater to be with us and just really have a conversation about what he is doing at his group there, how that translates to Oklahoma. We will talk about unfortunately, we'll talk about the condition of Oklahoma and Oklahoma's health, but I thought that'd be something that, what he translates from high-performing athletes, but also to the average person, to the folks who are in this room and folks you're interacting with every day around Oklahoma, and how do we improve things here in Oklahoma? So with that, let me read a quick introduction of Lance. Lance Walker is a licensed physical therapist, internationally recognized sports science expert, and former global director of performance at Michael Johnson Performance. You remember that name from the Olympics years ago? He has experience in both private business of sports performance and working with and in organizations from the NFL, NCAA, high school levels, as a published author, former human performance lab coordinator, Nike Performance Council member, and exercise science researcher. He now is leading the charge at Oklahoma State's Human Performance Nutrition Research Institute, focusing on transforming health through performance and science. So just really excited to have someone of Lance's caliber. I did promise him that we would not talk about OSU football during this conversation. As an OSU fan and three sons that 7 years, all my money has gone to OSU, we're not going to talk about that today. So we are going to talk about some other things. So Lance, thank you for joining us on one of our episodes of our Mulready Minute podcast. We dive deep into sort of insurance issues and health issues today and what will impact our state. Our state is quite obese. If I can read some numbers, if I have those right, 9th highest obesity prevalence in the nation, among top 10 most obese states according to America's health rankings. Not a good picture.
No, it's not. And thank you guys for having me. I appreciate this. And I've got notes written down because this was an important day for me. I marked this down on my calendar because I'd see you all as teammates. We have a common enemy. I'm fourth generation Okie. I grew up on a cattle ranch in northwest Oklahoma and southwest Kansas. Left Oklahoma, went to Texas to chase some dreams there for about 18 years. And I've come back to Oklahoma, and I wasn't paying attention. Shame on me. All my family still lives in this state, but the numbers are shocking. And when Dr. Shrum called me and said, "Are you interested in coming up here and running an institute of human performance and nutrition research to help us transform health in the state of Oklahoma through performance science?" I said, "What's the problem? What's the issue?" I hadn't even paid attention, but I've got some of these numbers written down, and I know I'm preaching to the choir here, but hear me out. These are striking. COVID-19 hospital admissions, we were worst in the country, number one. We're 10th. In 2018, we were 10th in obesity. You quoted the new numbers. We're going to be number one by 2030. 7 out of 10 of us are obese or overweight in the state of Oklahoma. 32nd in childhood obesity. That number is rising rapidly as well. 30% of children right now are obese. It's estimated, this just came out, And forgive me for not quoting references here, guys. If there's researchers in the hall, forgive me. I'll give you my references afterwards. But
We're not on campus here,
okay,
so
yeah.
you're
So
good.
just so you know, these are all. This is not my numbers or my research. This is just what's out there. This is one that got me because I've got a young one at home. I've got a 15-year-old girl at home. 50% of the girls in the state of Oklahoma between the ages of 15 and 24-year-old will be considered obese by 2050.
50%.
Yeah, I paused for effect. That shot me right between the eyes at home with my little one. 44th in healthy lifestyle, 42nd in physical activity. Less than 1/3 of Oklahoman youth get 60 minutes of play per day. Physical activity, less than a third. Less than half of us adults get 150 minutes of physical activity per week. And the U.S. physical activity has declined since 1965. It's declined by over 45%. So, you asked me the urgency of action. That should speak to urgency for all of us. I think whether you're just an Oklahoman that really wants to see us be healthier, or if you're in the business that stands to benefit from a healthier state of Oklahoma, I think those are numbers that should grab us all. Certainly grabs me.
So Lance, there's a part of that. Okay, if I could be so blunt, we're fat and lazy. Why should we care? Why does that matter?
Yeah. Well, I'll get some more numbers for you here. Depends, right? Depends on what matters to you, what matters to different folks. I know one of them is cost. Here's some more numbers that are striking, somewhat recent numbers here. This came from the Aspen Institute as well. Some great resources. And again, if you want my resources, just reach out and find me. It would be great to share these with you. The direct costs of physical inactivity, direct costs in terms of dollars, $90 billion in 2008 in the United States. Any guesses what it is now? $191 billion. So if you're interested in money, that's important. That's some impact. That's up 113%. By the way, at the United Kingdom, 26 billion, Brazil 6 billion, China 67 billion. You're getting the theme here, right? We're getting crushed. So if it's cost that's impactful, then that's one thing. Inactive kids. Some of you have kids. Maybe it's an impactful thing for you with kids. Kids miss more school, earn less at work. $2,700 per year. Higher health care costs. 1 week extra per year in sick days taken. 2 times more likely to be obese as adults, and may live 5 years less than an active kid in their lifespan. Speaking of active kids, that's the one that's important to me. I see this as a long-term play and a transformational play. You got to start young. Physical activity in the state of Oklahoma is dropping. It's dropping across the nation, but in Oklahoma, it's getting worse faster than most other states. I think only Nebraska is ahead of us in this poll for whatever reason. I don't know why. But physical inactivity is a real opportunity for us with our kids. And I think when you start looking at the positives of impact of physical active kids, you start talking about test scores improving. You start talking about 1/10 is likely to be obese, 15% more likely to go to college, 8% higher earnings when they're working, 1/3 the disability rate. The key one, though, and this is the impact for me longitudinally, is active kids have a statistically significantly higher likelihood of being an active adult. Active adults, statistically significantly higher likelihood of having what? Active kids. So this links up to a real long play. To answer your question, it's gonna have to play across that full continuum of how we get physical activity as one example of how we attack this, but it's gonna have to take a long lens approach as well. And so I think that hopefully answers your question why it's impactful. Yeah.
Well, and you started with a call from Dr. Casey Schrum. Many of us in this room know Casey as a big health advocate, also now the president of the university. But I think you quoted her saying, is there interest in coming to transform? That word just stuck out to me as you said that. And so help us understand what you're doing at your group, because when I read it, I think, oh, he's working with D1 athletes to super high performance, and how fast can you do the 40, or how high can you jump this, or whatever that might be. But the question that she posed to you was about transforming Oklahoma, not just transforming Oklahoma State's athletes. So add to that.
Well, and I tell Dr. Shrum this all the time. The first time I met her, maybe in the second time we had a conversation about this dream of hers to transform health in the state of Oklahoma through a performance lens. And she starts showing me we look at all the data, and I just kind of laughed at her the first time. And I literally laughed. I remember openly laughing, and she wasn't laughing. If you guys know Dr. Shrum, she has this cold stare, and she's looking at me like, why are you laughing? And I'm like, because I don't think that's possible. I think you've got me tagged for the wrong person. I'm the performance guy, right? I'm the sports guy. I'm the works with the Olympians and the NFL combine folks, and that's what I do. Why am I here? And very quickly I started to see that what she was talking about was leveraging this performance science approach to speak into the health science approach that we all know is important. And we're not saying we're replacing health science, but we are feeding into that as an additional catalyst to that work that health science does from the performance lens. And it started making sense to me because we've leveraged this performance science thing in elite sport for a very long time. Some of those key things that you might think about that are more team sports. So think about football players. If you want to talk the football team, what do? Performance science for a football player, one of the key things is they target performance with their approach. So we're not in there lifting weights with the football team. Some guy getting ready for the NFL combine. We're not doing resistance training, eating well and recovering well because he wants to stay well, stay healthy. No, that's a nice byproduct. What is he focused on? He's focused on the NFL combine that is 6 weeks away, and that's going to change his life one way or the other. So his focus is on a sprint, 6 weeks for that period of time that he's got to perform. And then there's going to be another sprint that happens after that to get ready for training camp. And then there's going to be another sprint to get ready for preseason. You see where I'm going with this? It was focused on performance versus the long-term, that lifting weights, Joe Blow is going to make you healthier. Unfortunately, that doesn't sell to the high performer. They want to attack a certain performance, and it becomes a nice Trojan horse for health because some of the same things that we do with our elite performers for the NFL combine training were some of the same things that improve their bone mineral density, that improve their lean body mass, that improve their mitochondrial health. Those of you that are paying attention, you're all starting to tick boxes. They're like, well, my patients that would be good for our general population. Yeah. It's not different. It's not mutually exclusive. And so that was part one, was sort of targeting that performance. Part two is in high performance settings, we measure, monitor, and manage controllables. So Coach Glass, as an example, is our great strength coach at Oklahoma State and does an amazing job, one of the best to ever do it. And he shares a slide where behind the scenes, he's measuring GPS outputs from his players in practice so he can monitor their workload, so he can dial an athlete up or down in workload or go to coach and say, hey, a little less over here or a little more over there to optimize the asset for game day. So we're monitoring and we're controlling the controllables almost like on a dial. How well did they sleep? What is their muscle tissue quality today versus last week? So these are all measurable, monitorable things that we use in performance. Yet, if we go to our doctor, no offense, but I get my blood checked. And then, do you have a heartbeat? Yeah, great. See you in a year.
Right.
All right? I mean, that's not really dialing into a performance mindset. So for me, I would want a deeper dive. I want more measurable, monitorable, and modifiable, controllable factors. And that's what performance science does. And the third that I think is important for this group, and this is one that is a challenge. I'm not saying it's easy. It's teamwork. I mean, that sounds so cliche. I know people are like, oh yeah, here we go with the teamwork speech. Performance science is about teamwork, and there's a cool term. It's called transdisciplinary science. It's blending together disciplines to bring out the best. So you got Coach Glass at Oklahoma State working with Scotty Parker in the training room, working with the dietitian, working with the behavioral health specialist, working with the technical tactical coaches in a mixed approach, not an individual siloed approach or a hierarchical approach. There's hierarchy there, but it's a truly blended approach. Very much like maybe in healthcare we are more of a fruit salad approach, where you got your pineapple and you got your grapes and and fruit salad is nice. We all like fruit salad, right? You got your orthopod, you've got your general practice, I'm a physical therapist, so physical therapy is in that fruit salad. That would be a multidisciplinary approach. Performance science leverages a transdisciplinary approach. So take all those ingredients and blend them together. Now you've got a fruit smoothie, right? Completely different output, completely different inputs in some cases, but just the organization of that becomes more transdisciplinary. Again, that's not my analogy. That was an analogy I stole from people. I'm the biggest hack on the planet. I just steal from really good stuff, and that's also what performance scientists do.
R&D.
We all steal from each other, right?
Rob and duplicate.
Yeah. So that's the idea. So it's a performance science approach that integrates and catalyzes and supports and plays with the health sciences that are already doing some amazing work. So I want to make sure it's very clear. We're not in here to, okay, health science, you failed. Let's take this new approach. This is a continuum approach and a catalyzation approach from a performance science lens.
Okay, a couple things I've thought of while we spoke. One is a side note, but you mentioned tracking the athletes, and I'm not going to spend much time on this at all, but so are the athletes wearing wearable devices so the coaches are tracking that on a moment-by-moment basis during the day, not during...
Well, yeah, one of the examples I used was global positioning systems, or a GPS, and so that was Coach Glass has been doing that with our football athletes. We use GPS even with our baseball athletes now, and so while they're in practice, even while they're in games, you don't see it, but there's a little GPS pod tucked behind their shoulders, and they're measuring accelerations and decelerations, which can cause different loads through the musculoskeletal system, measuring total distances, total workloads. They're able to flag, so Coach Glass is a genius with this, he's able to flag during practice when somebody maybe spikes in a workload above their typical average, and he can flag that and bring that to the forefront and say, hey, Coach so-and-so, let's think about maybe reducing some of the volume here, or let's monitor recovery there. So yeah, that's an example where that's a wearable, but it's being used it's been used in high performance sport for many, many years, and certainly it's being leveraged up the road.
Oh, thank you, that's fascinating. Brian, there's Brian. Next year, 2025 project, Oklahoma Insurance Department, we're going to start doing some...
I'd love to get GPSs on all use. Yeah, monitor everybody, yeah.
The other thing that I picked up when you talked about that, and even in your title of your group, is that word performance. And I'm struck by that D1 athlete. They've got that 6 weeks. Their definition of performance is different. My definition of performance today is different than it was 40 years ago when I was trying to run a 20-minute 5K. I don't know, but it was very different. Many people in this room, their idea of performing well might be, I want to be able to pick up my grandchildren off the floor without pain. I want to be able to go for a walk with the family after Thanksgiving dinner, that sort of thing. So talk about the idea of performance, the definitions and the stages of life.
You hit it perfectly. And that's, somebody said, oh, performance, you mean sports performance.
Right.
No, you're missing it. Pull up a level. Everybody's, it's sport, it's about sport. Yeah, sport for performance on Saturday is really important to an Ollie Gordon. That was really, everything was pointing towards a Saturday. And that was what was performance for Ollie Gordon. For me, performance, I want to be able to carry my kayak down to the Lower Mountain Fork River whenever I want to so I can go fishing. That's darn important to me, folks. And the minute I can't do that, I'm not very fun to be around. Okay? You may have the same thing. You mentioned picking up your grandkid. There's a great commercial that was at the Super Bowl commercials maybe 3 or 4 years ago now. The grandfather going out into the garage. First, he's looking at a picture. I don't know if you've seen this commercial. If not, email me and I'll send it to you. He's looking at this picture on his credenza, and it doesn't show you what the picture is, but he's looked at it and he's like, okay. And he gets up and he goes out to the garage and he polishes off this old rusty, dusty dumbbell or kettlebell. Have you seen this commercial? And he tries to pick it up and it drops down. He's frustrated. Then it fast forwards to the next morning. He hits the alarm at 6 a.m. He's out there and he picks it up twice and then sets it down. He's still frustrated. Fast forward again and again and again. And pretty soon he's picking it up and he's pressing it and picking it up and he's pressing it over time. And then it fast forwards all the way to the end. And you're like, what is this guy? What's going on with this guy? He goes to his, it looked like his in-law's house, rings the doorbell. In runs the granddaughter, right? And the granddaughter runs up to him and he pulls out the star for the Christmas tree and holds the granddaughter up, picks the granddaughter up and holds her up to put the star on the Christmas tree. That was performance for him. So that entire sprint that he took to get to that point was performance. Was he doing it for his bone mineral density and his metabolic health and his fall risk prevention? That doesn't sell necessarily as well in a performance mindset as to perform on game day, which was game day for him. These are the things that I have to do to get to that point, and then it's game day. He performs. He feels great about that. He's gone through this amazing process. Now he recovers, and maybe he picks the next piece of performance. I say this with all respect to all of us in this room and the athletes, but you all are athletes. We see you as athletes. I really do. No, I mean, I see you, you're competing against gravity right now. Some of you are getting whipped. But we all have our competitions, and I think when you begin to look at that through that mindset that you are all athletes, I'll be honest, selfishly as an Oklahoman, and for my charge from Dr. Schrum, if I'm going to be successful in this, I need you all to be the very best version of yourselves in your jobs today, tomorrow, and future.
Hear, hear.
Okay, please don't. There's no disrespect by that. I need you to be your best, because I selfishly want better for the state of Oklahoma, and you are a part of that. So if you're a CEO, I want you at your best when you're in that meeting. When you're on the phone, Dr. Schrum, I do this to her all the time. Hey, Dr. Schrum, I kind of need you to be really, really good. Okay, for this to work, I need you to be at your best. How can I help? How can we help with pieces of your lifestyle, pieces of your performance to help you be the very best version of yourselves for whatever's important to you? But selfishly, for me, I need you guys. I need you to be the best version of yourselves as athletes in this fight.
That's really good, really, really motivating as well. So let's move then, maybe, and you can add what else you want in here, but thinking of that, looking at this room, the audience that we have here, the thousands that we have in this room, how do we get started? What do we do? What do you focus on? How do we move to, and maybe part of that is setting a goal for what does performance mean for me at this age and this stage? To your point, you brought a great point to something very personal, my kayak, getting down there. Maybe we need to each establish those sort of goals, and then what do we do to get there? How do we get there?
I think it's helpful to, and it's cliche somewhat, to start with why. You've heard that comment. Start with why. What is your why? What is your why for choosing water over this? Why you choose to push away that and do more of that? But you have to have that why anchored. I think that helps. That's something in performance we anchor to all the time is, what's your why? Well, I want to be the best version of myself. I mean, that's pretty generic. Let's anchor. I've got the NFL Combine in 6 weeks. I need to be the best version of myself on the day to make the best chance for my future. So anchoring to a why, a big purpose why, but then maybe anchoring to some specific sprints of whys is one piece of it. Starting small, that seems obvious, but starting small as individuals, as teams that are working on this problem. Let's not try to boil the ocean. Let's not try to eat the entire elephant in one bite. Starting small at a personal level for me becomes what part of my lifestyle, what part of my day-to-day can I attack today that's going to help me tomorrow? And just like the athletes, we are focused on training and recovery and fueling. That's movement, eating, and rest, guys. It's the same thing. So those are the three things that you can control. Maybe pull out a piece of one of those three that you could really focus in on tomorrow. It doesn't have to be the whole shooting match. Just focus in on one little thing and choose the easiest one. I want to really work on my rest. Great. There's some great resources for us to tap into that are trusted resources to help us dive into that space and begin to hone that one little area. I just want to sleep better. Great. Simple starting point that could lead to ongoing behavior change. And the last couple of bits there that I think speaks to this group is data. I think data is going to be a real important factor for us as a team going forward, is how do we leverage data together as teams to really truly understand how do we keep people engaged, right? And part of it we know is personalization. I've seen some of your plans, some of your the benefits and the value-added benefits in some of your plans. You're trying to get your folks engaged. One of the things we know from performance, when we can personalize it, not just tailor it, not just generalize, but personalize it to you specifically, it drives engagement up. So that's one area where we can come together and maybe leverage data for that, and maybe leverage data in your own lives as well to make it personal to you. Really get it down to that personalized level. And then finally, guys, I think it's important to create a team, to have a team around you. Whether that's your doctor, that's your personal trainer, that's your spouse, whatever that is create that team, that tribe around you. And again, that's stolen from performance science, is that it's a village that's created around you, that's attacking your why with you in support of you. And sometimes that's up to us as the athlete to create that team. And the better chance you have then is having a true interdisciplinary or a transdisciplinary team that works sort of as that fruit smoothie, not in their own silos, but they also understand the importance of talking together and to working together. Again, easier said than done, but that starts small, pulls all the way up to, I think, the level that we're talking about here. I'm kind of pitching for teamwork with you all. I'll be honest with you, this is kind of a sales pitch. I need teammates. And I think you all bring a lot to the table. This group and what you stand for, what you're doing brings a lot to the table. We could team up and do a lot of that together. And so from a macro level, think about the team, and even from your own individual level, thinking about that team approach, I think, is a good first step.
Good. Well, in just wrapping up, Lance, I'm reminded as you say that, I've read multiple times how we tend to overestimate what we can get done in the short term and underestimate what can be done in a longer term. And so, yeah, you're not going to make a difference in the next 3 weeks, but you start small and do some things. In 2 years from now, you'd be amazed at where you can get from that standpoint. I also want to encourage this crowd that what he just mentioned. Now, don't just latch on to the rest part. You know, there were other pieces in there.
I love that. That's the easy play, right? I'm going to rest better. Think about that. That sells, right? That sells to my 15-year-old. Sleep better, honey. Okay, thanks. I'll do that. Love that. Exercise, diet? Maybe not, but rest better? We can all do that, right? So that's, tongue in cheek, but I think that's a small, easy win, I think, for a lot of us.
Yeah, okay. Any closing comments, thoughts, encouragements for this crowd as we wrap up?
I think there's some great resources available. We want to be a resource to you all. We want to be a teammate. So please, first of all, I'm not hard to find. HPNRI is a pretty easy find on the web. You can find us at oklahomastate.edu as well. I'm in there. You can email me and throw a pencil at me if you don't agree with what I'm saying or challenge me. But I encourage that. This is not going to be an easy thing. I'm not standing up here saying I've got all the answers either. I've got none of the answers. That's where research is going to help. But you as a teammate reaching out to us and, hey, that would be interesting for me at a personal level, or that would be interesting for me at a macro, maybe within my company in terms of teaming up. So I'd encourage you to do that. But also encourage you to leverage existing resources. Oklahoma State is a great resource for us. The Oklahoma State Extension Office offers some amazing, very simple, but very effective fact sheets that are available to all of you for free right now. And it's things like nutritional sciences that come from some of our experts on campus that have been procured. It's somewhat general, but it's something, again, that it's a trusted resource that you can go to. TSET, a partner of ours with several projects, is another great resource that's offering up some amazing, things for kids. The This or That site is really cool to making choices when you're in the convenience store. This versus that. Simple resources that are available to leverage. And then some advanced resources. Thinking about trends. I think that's something you can help yourselves with. Recommendation is to think about the trends that are looking ahead. In 2025, some of the trends that we're seeing, things like wearables. More of your constituency are going to be using wearables. They're going to get cheaper. They're going to be more accessible. Data. The data that's coming out of these wearables, the data that's coming from your phones right now about you, that's going to be more accessible and more leverageable as well. And getting back to basics. It's very interesting. We feel like that pushing into the basics of, let's be a great basic resource for people. Where is your athletic trainer at your high school? Are they enabled with the greatest and latest resources for the kids that are playing sports right now? So be an advocate for getting back to some of those things in your own communities, and that will help us. Again, I'm shameless plug here. I need your help. I want you to leave with that. I need your help, and I want to help you because I think we have a shared purpose here and a shared enemy that can help us both.
Yeah, that's really great, Lance. Thank you. And I just was reminded of something else as you were speaking of the this and that. I'll throw this out to you. Keeping things simple. When our boys, many of you know our sons, they're now 21, 23, 24. But when they were smaller, you have your battles, right? Well, we had our battles with cereal. Right? They want all this junk cereal. Well, I don't know, on a fluke, I came up with this idea. And so we had this rule in our house that you got to look on the side of the box. If there's more than 10 grams of sugar, that is a trash cereal. And the trash truck only comes on Tuesdays and Fridays to our house to pick up our trash. And so they were allowed to have trash cereal 2 days a week, but otherwise had to be less than 10 grams of sugar in there. So to this day, it's a thing with my boys.
I love it. And I'll tell one quick story because that's strikes close to home. I'm supposed to be some kind of expert in this field, right? That's what you said anyway. I'm going to take that. I guess I'm supposed to know something about performance. And I've got an 18-year-old at home, 17, going to be 18 in January. And he's very good in school, very good in sports, and does all those things. He loves video games. You guys have, I don't know, you guys have kids that do gaming at home? Maybe none of you do. This one does. It's important to him. And I'm always trying to get him to eat better. And so I'm coming at him with all these statistics and all the stuff and all the science, and he's like, yeah,
goes
whatever,
well with a 17-year-old.
whatever. I finally had to learn a little bit about kind of leveraging that to speak to his why. And I figured something out the other night. I was up there having my same weekly discussion around that junk food that you have sitting there that somehow I bought for you, that you're consuming at 11 o'clock at night while you're gaming, is not healthy. You're going to get blah 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 blah. And I finally stopped myself and I looked, and he's on the game, and he makes a mistake. And the game with other kids, right? So you can hear the other kids yelling at him, "You dummy! Why'd you do that? That was a terrible mistake. How did you make that error? You were so late to that, whatever." And a light bulb went off, and I went, hold on a second. I need to leverage science from a performance standpoint in this instance. And so I was able then to leverage performance science to link that food that you've decided to eat with hand-eye reaction speed. I said, hey, Bodie, I don't know if it's important to you or not, but there has been studies linking this to slowing that down. Have a nice night. That stuck. I don't know. Again, I get goosebumps thinking about it. Now I'm tucked into his why as a Trojan horse to what I really want him to do, which is not eat that crab. But now it's attached to something that's important to his performance. So, yeah, thanks for bringing that up, because that was a great story. It just literally happened a few months ago.
Good. Well, Lance, thank you so much for being on our first ever live Mulready Minutes podcast. Hopefully you guys have enjoyed this. I'll tell you, little takeaway. Keep it simple, rest well, eat less, move more. That's simple. So thank you. Please give Lance a round of applause.
Thanks, everybody.
Thank you for tuning in to today's episode. If you found this episode informative, please subscribe and share with your colleagues. Visit oid.ok.gov/podcast. Let us know what topics you would like to hear about on this podcast. Until next time, take care. From the Oklahoma Insurance Department.